First on Health Matters, this time of year can be especially difficult if you have diabetes or any chronic health condition. It's hard enough to eat healthy every day, but how can you avoid the cakes, the cookies, and other holiday foods served at holiday get-togethers? Well, oftentimes I don't avoid them, unfortunately. Joining us now to help patients with medical conditions enjoy this special time while staying healthy is Baptist Medical Group's endocrinologist, Dr. Shimon Harary. Welcome to be on our show today.
Thank you for having me.
Okay, you're an endocrinologist. You specialize in diabetes, but you also take care of other health conditions as well. What do these poor people do during the holidays when all of this holiday food is put before them? They're trying to do right. They're trying to keep their hemoglobin A1C down, but it's the holidays. What's your advice to them?
I generally tell my patients to try to keep a balanced focus. In general, just not to stray from the guidelines that we've been teaching them all along. Nothing really changes. There's more food and maybe more delicious food, but the guidelines of a generally carbohydrate-controlled diet haven't really changed. However, I tell all my patients that there is no food that they cannot have. They can have any food they want, ice cream every day as long as the balance is there.
Did you hear that? Ice cream every day.
That's right.
Okay, go ahead.
But if you're eating more ice cream, you're eating a little bit less pie or a little bit less potato, less bread, the balance has to remain so the overall control is reasonable. So you can have the ice cream, but something has to give somewhere. That's what I tell them.
So if you have that piece of pumpkin pie or pecan pie, which is very good, then you skip some carbohydrates somewhere else. You skip the bread or the mashed potatoes or something like that.
The guidelines I give my patients are generally they have an idea of approximately how much carbohydrates you're going to have every meal. In a simplistic way of looking at it, if you had a plate, the carbohydrates should not be more than a quarter of the plate. And everything should fit in there. So they know that if they're going to stick in a pie in there, something else is probably going to come out. Otherwise, they will get in trouble. I also give them other tips that they can generally use when they're going to parties or to events or other people's houses where they don't have control over their diet or what they're being served. So one rule is if you don't see it, it won't bother you. If you're going to a party, try not to hang out at the big tables all the time. Go talk to the people. Don't hang out near the pies and alcohol per se. Alcohol, speaking of alcohol, alcohol can cause a lot of glycemic changes. Your glucose can go up and down, especially on an empty stomach. So you want to kind of have little tips to help you sort of get over those temptations that might be a little bit too much sometimes.
Now, do you tell your patients, especially the diabetic patients, to maybe monitor their blood sugar a little more often or closer during the holidays?
I actually do not in general. I try to have them in a place where no matter what they do or where they go, they're checking blood glucose enough times to keep good control. However, if they feel like they don't feel well or they know that they're outside their usual mode of eating, then I'll tell them to check a few more times, especially if they're having symptoms.
Now, during the holidays, of course, a lot of people travel. What's your recommendation to patients about traveling that has diabetes, that have insulin syringes? What do you tell them?
Well, regarding travel, or really anytime you leave the house, you want to plan ahead in a reasonable way to be prepared. That is true regarding diet and regarding medications. Whether you have an insulin pump or blood pressure medications or any endocrine or other chronic health issue. So I generally tell my patients, if you know you're going somewhere, please take a look at your inventory. Do you have enough vials, enough syringes, enough medication, enough tablets for what you're going to need? Especially if you're eating more, if you might be a little bit looser in your control, be prepared because during the holidays, it's harder to get a prescription if you need it.
So it's important to make sure they got plenty of medicine before they leave and travel elsewhere.
Absolutely. It's important, even if you're staying home, you want to try to plan your meals a little bit. So you don't have to have that huge carbohydrate stuffing that you're in. You can make a more vegetable type stuffing. Add cauliflower and vegetables instead of pure potato. There are little tricks you can do to sort of decrease the carb load. One thing that a lot of my patients appreciate sometimes is the idea of Thanksgiving doesn't have to be about having huge amounts of leftovers. You can plan for the meal and make just the right amount of wonderful food, but once the holidays are over, they're over, and we don't have to keep eating the holiday type food for the next few weeks. That helps a lot of people.
Try to stay in the routine that you've already taught them to do.
It's an exceptionally happy time, but we have to sort of retain our overall sense of control.
And we have a little bit of dressing, right?
Absolutely.
We have a little dressing.
Yes. A little bit of everything, but something has to give, I think.
And green bean casserole as well.
Sure,
you can have that.
Sure.
All right, well, thank you so much for being here
My
today.
pleasure.
Good
Thank
to
you.
see you, sir. Coming up next, it's hard to find time for you to exercise during the holidays. Our next guest will give you some tips on scheduling workouts while still fulfilling your other obligations. Stay with us on Health Matters.